NCLEX 2025 is here. The new exam isn't just multiple choice anymore. Did you know that in 2024, almost 10% of U.S. educated students failed the NCLEX? Nearly half of repeat test takers failed again? And nearly 50% of international students failed on their first try? Only 36% of repeat test takers actually passed. These are real stats from ncsbn.org. But don't worry, in this video, you will learn how to tackle matrix grids, multiple response questions, SATA, and case studies, all while mastering the NCLEX format and avoiding costly mistakes. The number one prioritization trap that most students fall for, the exact delegation rules to never lose points, and the secret to solving NGN questions faster and smarter. Time is running out. Don't risk failing. Hit like, subscribe, and let's dive in now. You are a nurse working in the emergency department. Patients arrive with various medical conditions, and you must prioritize their care based on the urgency of their condition. You have learned that patients are classified into three main categories: highest priority clients, urgent priority clients, non-urgent clients. Based on the above information, which of the following statements are not correct? Option A, patients with muscle strain are classified as highest priority clients. Option B, urgent priority clients require medical service within 30 minutes to 120 minutes. Option C, triage does not consider the urgency of care required for patients. Option D, non-urgent clients can wait indefinitely for healthcare workers. Option E, clients with open fractures are classified as urgent priority clients. Option F, acute heart conditions are classified as non-urgent priority clients. I will give you some time to go through the questions and options. Please make it quick and write your answers in the comments section. I will soon explain the answers after the timer runs out. Okay, time's up. Let's see the correct answers. Option A, patients with muscle strain are classified as highest priority clients. This is incorrect. Muscle strain is a non-urgent condition that is not life-threatening. It is classified as a non-urgent client and can wait. It's not given the highest priority. Option B, urgent priority clients require medical service within 30 minutes to 120 minutes. This is correct. This statement is accurate. Urgent priority clients need medical service early, as their conditions are not immediately life-threatening, but could worsen if not treated in a timely manner. Conditions like open fractures and medium burns fall into this category. Triage does not consider the urgency of care required for patients. This is incorrect. This statement is false. Triage does consider the urgency of care required. It is the very foundation of triage to prioritize patients based on the severity of their condition, ensuring that those who need immediate intervention are seen first. Option D, non-urgent clients can wait indefinitely for healthcare workers. This is incorrect. Non-urgent clients can wait for a few hours, but not indefinitely. While their condition is not life-threatening, they are still assigned a wait time, typically up to 2 hours, based on the triage process. Option E, clients with open fractures are classified as urgent priority clients. This is correct. This statement is accurate. Open fractures are considered urgent priority because they are not life-threatening, but still require prompt medical attention to prevent complications like infection or further injury. Option F, acute heart conditions are classified as non-urgent priority clients. This is incorrect. Acute heart conditions are considered highest priority because they are life-threatening and require immediate attention. For example, a patient experiencing a heart attack would fall into this category, needing urgent medical intervention. I hope that was helpful. Keep up the great work, and remember, prioritizing patients is a key skill in the emergency department. This time, I'll give you some case studies, and you need to figure out which action reflects the correct approach for prioritizing patient care. Let's see the case studies first. Case 1. A nurse in the ER is faced with a patient who is showing signs of a heart attack, while another patient has a sprained ankle and the third has a mild headache. The nurse prioritizes the heart attack patient for immediate care. Case 2. A nurse is working in the recovery room where one patient is in significant pain after surgery, but the other patient is showing signs of respiratory distress after coming out of anesthesia. Case 3. A nurse on a mental health unit is caring for 3 patients. One is actively suicidal, another has anxiety, and the third is experiencing a panic attack. The nurse focuses first on the patient who is suicidal. Case 4. A nurse in a pediatric ward has 3 children, one with a mild fever and dehydration, one with an asthma attack, and another with a small laceration. The nurse chooses to address the child with the asthma attack first. Now let's see which of the following actions reflects the correct approach to prioritizing patient care, based on Maslow's hierarchy of needs and the concept of prioritization categories. Option A. Case 1. The nurse prioritizes the heart attack patient immediately, as life-threatening conditions should be addressed first. I'll pause here, think about it. Does this make sense? Yes, it does. This is the correct approach. It aligns perfectly with Maslow's hierarchy, where physiological needs, like survival, take precedence. A heart attack is life-threatening, so the nurse should prioritize it immediately. Option B. Case 2. The nurse decides to treat the pain patient before addressing the respiratory distress patient, assuming the pain is more uncomfortable. Let's pause for a second. Does this sound like the right approach? Not quite. This is the incorrect approach. Why? Respiratory distress is a life-threatening issue and should be prioritized. Airway and breathing come first in any situation. Pain management is important, but it's not more urgent than respiratory distress. Option C. Case 3. The nurse focuses on the patient with anxiety, as anxiety is often the most distressing to the patient. Take a breath and let's reflect on this one. Is this the correct approach? Nope, it's not. The correct approach here is to focus on the patient who is actively suicidal. Safety is the #1 priority, and suicide prevention is more urgent than anxiety or panic attacks. Option D. Case 4. The nurse addresses the child with the laceration first, assuming it's the least urgent but most manageable condition. Let's pause. Is this a good decision? The answer is no, it's incorrect. In this case, respiratory distress from asthma should be prioritized over the laceration. Respiratory distress is potentially life-threatening, and it needs immediate attention, even though the laceration might seem less urgent. All right, so let's recap the right answers. Option A is correct. The heart attack patient is the highest priority. Option B is incorrect. Respiratory distress takes priority over pain. Option C is incorrect. The suicidal patient should be prioritized over anxiety. Option D is incorrect. The child with asthma should be addressed before the laceration. Great job. Keep practicing, and you'll continue to improve your prioritization skills. You're doing awesome. All right, let's dive into a matrix-type question this time. Are you ready? Let's go. Which of the following statements indicate a correct understanding of prioritizing patient care based on Maslow's hierarchy of needs and nursing priorities? Take a deep breath. Here are your statements. Statement true/false. A. In an emergency, social needs should be prioritized over physiological needs if the patient is stable. B. It is acceptable to delay treatment for life-threatening conditions if there are other non-urgent tasks to complete first. C. Nursing prioritization should always align with personal knowledge and experience, as they directly correlate with patient outcomes. D. The priority of care may shift throughout the patient's treatment. So continuous reassessment is key to ensure appropriate care. E. Even low-priority care tasks must be revisited regularly, as changes in a patient's condition could alter their care needs.
Hey, I just wanted to quickly share something with you that I think could make all the difference as you prepare for the NCLEX RN. I know how stressful it can be, especially when you're balancing everything: clinical hours, coursework, life, and trying to carve out time to study. Trust me, I've been there. That's why I highly recommend checking out the 4 weeks to NCLEX RN questions and answers practice guide. It's a taken for preparation of this video. What's awesome about this guide is how it's designed specifically for busy students like you. It breaks everything down into manageable weekly goals, so you're not overwhelmed and you know exactly what to focus on each week. The structure is simple but really effective. Week 1 sets you up with foundational strategies and helps you get comfortable with the question formats. Week 2 digs into the core nursing concepts, things like patient safety, prioritization, and critical care. Week 3 covers pharmacology and body systems, which we all know can feel like a huge challenge. Then, Week 4 is all about practice realistic exam simulations and reviews that really help you gauge where you stand. What I love most about this guide is that it doesn't just focus on the right answers. It's all about understanding why the correct answers are right and why the others aren't. It really teaches you to think critically, which is such a huge part of the NCLEX. If you're looking for something to help you stay on track without adding more stress, this guide is worth checking out. I really think it could make your prep a lot smoother and, most importantly, help you feel more ready. Good luck. You've got this.
Let's walk through the right and wrong answers now. Breathe and focus. This is important. Option A. This is false. According to Maslow's hierarchy, physiological needs, things like breathing, circulation, and nutrition, always come first, even in emergencies. Social needs, though important, come after physiological and safety needs. So even if the patient is stable, physiological needs should be prioritized. Option B. This is false. Life-threatening conditions should never be delayed. If someone is facing a life-threatening situation, that needs to be addressed immediately. Non-urgent tasks can wait. Always focus on life-saving care first. Option C. This is false. While your personal knowledge and experience are valuable, prioritization needs to consider patient conditions and available resources in the environment. Relying only on personal experience without assessing the full picture could lead to inadequate care. Always assess the patient's current situation and available resources too. Option D. This is true. The priority of care can shift as a patient's condition evolves. That's why continuous reassessment is so important. Priorities change, and nursing care must adapt to those shifts to make sure the most urgent needs are always addressed first. Option E. This is true. Even low-priority care tasks should be revisited regularly. A patient's condition can change, and a situation that seemed non-urgent might need immediate attention later. So keep reassessing and staying aware of any shifts in the patient's needs. Great work so far? You're doing awesome. Let's quickly review. Option A is false. Option B is false. Option C is false. Option D is true. Option E is true. Keep practicing and keep that enthusiasm going. Let's now see a different type of question. This time, it's a drag and drop kind of question. Are you ready? Here we go. You are a nurse in a busy emergency room and you have 4 patients waiting for care. You have limited resources and time, so you need to prioritize your actions. Here are the patients. Patient 1, a 45-year-old male with chest pain and difficulty breathing. He is sweating heavily and appears anxious. Patient 2, a 60-year-old female who fell off a ladder and has a compound leg fracture. There is visible bleeding from the wound, but she is alert and responsive. Patient 3, a 25-year-old female with a minor cut on her hand, a mild headache, and no significant distress. Patient 4, a 70-year-old male with a history of hypertension who presents with altered mental status and difficulty speaking. His vitals are unstable and he's showing signs of a possible stroke. Now, drag the following actions into the correct priority order from highest to lowest based on ABCs, Maslow's hierarchy of needs, and clinical triage principles. 1. Administer oxygen and prepare for immediate assessment of breathing and circulation for patient 1, chest pain, difficulty breathing. 2. Stop the bleeding and stabilize the leg fracture for patient 2, compound fracture, bleeding. 3. Monitor vital signs and prepare for possible CT scan for patient 4, altered mental status, possible stroke. 4. Clean and dress the minor wound on patient 3, minor cut, mild headache. Take a second to think it through. Ready? Let's go over the correct order from highest to lowest priority. First priority, patient 1. Administer oxygen and prepare for immediate assessment of breathing and circulation. This is the highest priority. Patient 1 is presenting with chest pain and difficulty breathing, which are classic symptoms of a potential cardiac event. His condition could deteriorate into a life-threatening situation very quickly. Administering oxygen and assessing circulation, like heart function, should be done immediately to prevent cardiac arrest or respiratory failure. This aligns with the ABCs, airway, breathing, circulation, prioritization framework, and it's also in line with Maslow's hierarchy of needs, where physiological needs, air, oxygen, circulation, always take priority. Second priority, patient 4. Monitor vital signs and prepare for possible CT scan for patient 4. Altered mental status, possible stroke. This is the second priority. Patient 4 is showing signs of a stroke, a neurological emergency. While their airway and breathing seem stable, their circulation, blood flow to the brain, is the primary concern. A stroke requires immediate intervention to restore circulation, which may involve thrombolytic therapy or surgical intervention. According to Maslow's hierarchy, ensuring basic physiological needs, like brain oxygenation, is the top priority. So monitoring vital signs and preparing for further tests, like a CT scan, is crucial here. Third priority, patient 2. Stop the bleeding and stabilize the leg fracture for patient 2, compound fracture, bleeding. This is the third priority. Although bleeding and a fracture are serious, they are non-life-threatening compared to cardiac or stroke emergencies. The first step is to stop the bleeding to avoid shock and then stabilize the fracture. This action aligns with Maslow's hierarchy of needs, specifically safety and physiological needs. Once the bleeding is controlled, fracture care can proceed, but it doesn't carry the same immediate urgency as the other patients with life-threatening conditions. Last priority, patient 3. Clean and dress the minor wound on patient 3, minor cut, mild headache. This is the lowest priority. While it's still important to treat the wound and provide comfort for the headache, this situation doesn't indicate life-threatening distress. It's not urgent compared to the other patients who need immediate intervention. According to Maslow's hierarchy, life-threatening injuries and conditions always take precedence over minor wounds. So this task can wait for now. Let's quickly review the correct order. 1. Patient 1, administer oxygen and assess breathing and circulation. 2. Patient 4, monitor vitals and prepare for CT scan. 3. Patient 2, stop the bleeding and stabilize the fracture. 4. Patient 3, clean and dress the minor wound. You did great. Keep practicing this and your prioritization skills will continue to improve. Keep up the fantastic work.
Hey, if you're looking for a solid resource to practice questions and answers as you get ready for the NCLEX, I've got a recommendation that might really help you out. I recently found the Next Gen NCLEX RN Practice Question Bank, big book of question-answer practice, and it was super helpful for preparation of this video as well. If you're trying to get comfortable with the new Next Generation NCLEX format, this book is definitely worth checking out. It's got daily practice questions that are designed to reflect what you'll see on the exam, which is awesome because it gets you into the right mindset. Plus, after each question, you get detailed explanations so you'll not only know the right answer but understand why it's right and why the other options are wrong. That really helps you build your critical thinking, which is key for the NCLEX. I also love that it includes study tips and strategies specifically tailored for the NGN format. And if you're like me and need a little motivation, it has success stories and insights from other nurses, which really keep you inspired throughout your prep. If you're looking to practice and build confidence, this could be a great resource to add to your study routine. It's structured so you can stay on track and focus on mastering the material step by step. Just thought I'd share in case you're looking for something to really help with those practice questions.
The next question is a fill-in-the-blanks type. Take a moment to really study these patient case studies carefully. This one is important. Let's look at patient 1. Eye-opening. The patient does not open his eyes in response to any stimuli. Verbal response. The patient is making incomprehensible sounds but cannot speak. Motor response. The patient exhibits decerebrate posturing when stimulated. For patient 2, eye-opening. The patient opens his eyes to verbal stimuli. Verbal response. The patient speaks in disoriented, confused sentences. Motor response. The patient is able to move all limbs, but only in response to painful stimuli. For patient 3, eye-opening. The patient opens his eyes spontaneously. Verbal response. The patient responds coherently to questions. Motor response. The patient obeys commands to move all limbs. Now take a breath and let's look at the fill-in-the-blanks question. Which of the following patients should be priority for immediate intervention based on their Glasgow Coma Scale GCS score? Options: 1. Patient 1, GCS score 3 by 15. 2. Patient 2, GCS score 10 by 15. 3. Patient 3, GCS score 15 by 15. 4. Patient 1, G score 8 by 15. 5. Patient 2, 8 by 15. Before we dive into the options, let's talk about the GCS score so we can make the best decision. The Glasgow Coma Scale, GCS, is a tool used to assess a person's level of consciousness after a head injury. It evaluates 3 components. Eye-opening, scored from 1 to 4 from no response to spontaneous opening. Verbal response, scored from 1 to 5 from no verbal response to being fully oriented and conversant. Motor response, scored from 1 to 6 from no motor response to obeying commands. The total GCS score ranges from 3 to 15, with lower scores indicating more severe impairment and higher scores indicating better neurological function. Let that sink in. Now let's break down the answers. Answer explanation. Patient 1, GCS 3 by 15. This patient has the lowest GCS score, meaning there's severe impairment of consciousness. No eye-opening, incomprehensible speech, and decerebrate posturing are signs of major neurological compromise. This patient is at high risk for neurological deterioration and needs immediate intervention. This patient is the priority for intervention, especially for airway management and neurological monitoring. Patient 2, GCS 10 by 15. This patient is conscious but confused and disoriented. Although their GCS score suggests moderate impairment, their airway and breathing are still stable. They still need urgent monitoring, but the immediate need for life-saving interventions is not as critical as for patient 1. Patient 3, GCS 15 by 15. This patient is fully alert, coherent, and able to obey commands. There's minimal neurological impairment here. While this patient still needs monitoring and may require further tests or imaging, they are lowest priority for urgent interventions. The correct answer is patient 1, with GCS score 3 by 15. This patient is the highest priority. Neurological intervention, airway management, and possibly advanced imaging are necessary because this patient's neurological status is the most compromised. Immediate action is critical for survival. Take a deep breath and let's do a quick recap. Patient 1, GCS 3 by 15, is the priority for immediate intervention. Patient 2, GCS 10 by 15, needs urgent monitoring but not immediate intervention. Patient 3, GCS 10 by 15, is stable, so they're the lowest priority. Great job! This is a tough one, but with practice, you're getting better and better at this. Keep it up.